It's my great pleasure to introduce our next speaker, Dr. Kavitha Ramchandran. Dr. Ramchandran is a clinical associate professor of medicine and the medical director of the cancer care services at the Stanford Cancer Center. She's an expert in integrating palliative care into the oncology team and is a highly valued member of the Stanford Cancer Center. So thank you so much for joining us today.
So nice to meet you all. Thank you for being here, and I'm excited to be here with you all as well. I want to thank Heather for bringing us all together for this really important event. So Heather introduced me, and I have this very exciting topic, life after treatment, which I don't really know very much about. You all do. So I'm here to really learn from all of you, and in my 12 years of practicing at Stanford and many years of working with Heather, I've had the privilege of really getting to know many of Heather's patients and getting to know a little bit about what it means to go through treatment with head and neck cancer. And what I've learned is to be humble and to listen well and to offer advice not very often. So what I'd like to do is take this next couple of minutes to actually be a little bit reflective. And if you guys feel like you can speak up, feel free. I was a little technically inhibited yesterday when I tried to do this word cloud thing. It didn't quite work. So I actually am going to say, if you feel like speaking up, go ahead. And if you don't, it's okay to just be a little bit reflective. So in taking care of folks, I've learned that there have been a lot of emotions that people go through when going through treatment, and there's a wide array. And so just taking a minute to reflect on those pieces, and then we'll talk a little bit about some of the medical pieces, which I hope that all of your doctors and therapists are holding you. So one of the things that a lot of my patients have pointed out that there's really no after in life after treatment. It's like a through and a during and still going and still moving. And as long as you still keep moving, then it's good, right? And so I just want to be cognizant of that. And it starts at the beginning and it just continues. And so there are challenges along the way. And I don't know all of them, but I can imagine you all do. And I'm curious if any of you want to share one of those challenges that comes with going through this. Yeah, food is good, right? And this is a big change in how we perceive and can manage food. So yes, dry mouth is a great example. Other challenges folks feel like sharing?
I echo that in terms of no longer having the capacity to eat for taste, but instead for fuel, according to my body.
Yeah. And that's a big shift, especially for a culture where we spend a lot of energy on food. And food is also a way that we all take care of one another. So it's not only frustrating for the person who's going through it, it's also frustrating for loved ones because they're like, wait, I want to feed you. I don't really know how else to take care of you. And now you're telling me that that's not the best way to take care of me anymore. So it's a big shift. Other thoughts?
So I noticed in the initial, right after I completed treatment, I guess, the first instance of discomfort was the mucositis, which was pretty nasty. And then for maybe several months, 6 months, maybe, I sort of was halfway in the thaw. Sometimes I felt okay, and sometimes I just kind of felt out of it. And then after that point, I had a feeding tube in, so I wasn't eating anything by mouth. And then at some point, when the feeding tube came out, then I had to start eating. And, it was pretty hard. And as this woman here was saying, I was thinking about it. I no longer had any appetite. I still don't have any appetite. I never have an appetite. Sometimes my wife will say, well, what are you hungry for? Nothing. But so my mantra is I don't live I no longer live to eat, I eat to live. And that's what you have to come to terms with, at least for me.
It's a big change, and I think you said it very beautifully. And I even think that this whole concept of what you went through from the beginning, through that like fog, and then having to relearn the whole concept of what it means to eat to live, is a whole different place, and not everyone always understands that. So it's beautiful. So other emotions that folks often tell me about is sadness, and grief. And I think going through a cancer diagnosis is hard, but going through a cancer diagnosis that takes things away from you in a way that you may not be able to bring back is a place of grief. And it's really being able to go through understanding what it means to experience those losses, and then to be able to come through that. And I'm curious if people, and if you don't feel comfortable, it's okay, but if anyone wants to share anything that's brought them sadness in this process, patients or caregivers.
Well, for me, the sadness is not being able to enjoy food like I used to. I have a different deliciousness factor, like when you used to have that favorite piece of chocolate or something that you remember was just so luscious. Now, when I put chocolate in my mouth, the sadness comes in, and it's like, yeah, okay, it's chocolate, but it's not that same deliciousness factor that I had before, because the dry mouth and your taste isn't 100%. It's still not 100%, and it may never be 100% for me. So when I go out or I go places to eat, I also find that I can't enjoy some of the foods I used to enjoy. I'll still have them, but they don't satisfy me the same way they used to. They don't give me that, this is a great steak, for example, because now steak to me is like cardboard. It's not soft and luscious. It's just having to eat, to eat. So that brings sadness to me because, my family will have, hey, we're going to have this great meal. And I'm like, yeah, oh, okay. Okay, yeah, great. But for me, it brings that sense of sadness. But I also look at it on the other side, saying to myself, it's okay. It's a new journey. It's a new path. Move on. And that's just how it is.
Yeah, absolutely. Thank you for sharing that. And then I saw a hand over here.
So one of my biggest challenge, like now technically 10 years after my cancer treatment for stage 4 nasopharyngeal, is that I look like a normal person, but I eat like a grandma. And it's almost become like an invisible disability that sometimes the people look at me, they don't fully understand why it took me so long. Or some people will even come up to me like, oh, you're amazing, you eat whole day and you're not gaining any weight. Like, so that sort of lack of understanding, because it's not obvious, right? And some of the challenges would be like, say, if I go to certain leadership training where like they require like people cannot eat whole day, like you have to be 100% concentrated, even online training. And I have to explaining over and over again that I actually need to eat whole day in small amount because my saliva gland is damaged, that I can't talk if I don't drink water. I can't eat if I don't have a lot of water, and that means that I fill up quickly, then I get hungry quickly, and I need small amount of food throughout the day, and I need to, able to maintain that energy to be able to be present, whether it's an in-person event or even online event. So there's a lot of like negotiation of like, there's certain period of time I can't be 100% on camera. I need to be off doing other things, but really trying to have people understand that invisible disability is still a disability. Just because I look normal, and I don't no longer look like a stage 4 cancer survivor, that doesn't mean I don't have those disability. Yeah, so like it's a mix of like sadness, or like I also learned the hard way of like, how do I make that communication effective, not like immediately turn off when I feel being judged, or like feel like I need to fight for like tiny little things, Yeah, so like it's a growing process as well. Thank you.
And I can see the mix there of challenge and grief, because part of you is like, this is a challenge. And then there's some grief in the fact that you have to keep advocating for yourself. Like, keep advocating, whether it's like, I can't eat that, or I need your support, and I don't want to keep explaining myself for why I need support. Those are huge, huge points. I think so. Oh.
I think one of the things that happens when you get a cancer diagnosis is then it's, you know, there are lenses we get in our life. Like when you become a parent, that changes. That's the lens you now have on basically your whole life. And getting a cancer diagnosis puts that lens of, you know, what are my health concerns going to be down the road for that? Or what do I need to consider for food? Or what do I, you know, all the extra planning, the interactions with people, all of that sort of thing. And I think the thing that makes me sad about that is I kind of miss the me before I was a cancer survivor. And you know, that you have to be in a room like this for everyone to kind of get that, the not, you know, other people living with chronic illness and that sort of thing know sort of what you're going through, but there's nothing quite like being around a group like this, which is helpful. But I miss that, you know, pre-cancer me.
I think that's really beautiful. It's this grieving your old self. I remember a patient of mine when I was a medical student a long time ago. She was a beautiful young lady, and she's like, I want to show you my favorite picture. And I was like, okay. And so she pulls out her driver's license. And she was like, this is a picture of me before all of these things happened. And it was just a very poignant moment for me because it was another time for her. So.
Oh, the saddest thing for me is now I'm the patient. I'm not who I was before. My role in life has been turned upside down.
Yeah, and I think many people who are in many roles in their life used to be caregivers or clinicians or therapists or bankers, or it's suddenly to have this other role of being the patient can feel very disconcerting and very sad because that's not a role we've had before. So it can also be inspirational. And I'm wondering if there have been things along the way that have inspired you in going through this treatment and going through surviving, living.
One thing cancer taught me was to look for the silver linings. And for me specifically, we retired and we were able to, when we first retired, we decided, okay, now we can go traveling. So we traveled a bunch of places. And then I got the cancer after that. So we were able to retire and do some traveling. But I only discovered this after, you know, in retrospect. And then I also realized, well, we had the advantage of now being Medicare eligible. So it like, you know, that service was, not only did the doctor save my life, but so did Medicare. And those kind of things I found very inspiring, and I probably would not have appreciated that but for having had the cancer. No.
I don't think I would have ever heard Medicare and inspiration in the same sentence, but I am grateful for that. I'm sure someone in government out there is clapping their hands, but that's awesome. And I'm glad that it all did work out.
So let me build on the Medicare part, because Covered California does not do a lot of great things for people, particularly those wanting to go to Stanford for cancer care. So I was very much in a similar situation in terms of working somewhere, going into COBRA, transitioning from COBRA into Covered California, and suddenly no access to any of the Stanford folks, whether it's speech language pathology, whether it's oncology or anything else. And suddenly having to make hard choices because, like what is it, the 2%, I'm showing things that look like lesions, blah, blah, blah. So I was really grateful for Medicare as well because it allowed me to continue with this after a 9-month interval of just really, really painful crap. I'm also inspired by so much of this community, and I'll do my plug for past symposiums. At least 2 of them, if not more, are online that you can see things. And I'm going to stop now because I did about a 20-minute droning, 20-minute-ish, in the last symposium about things of which at least 3 or 4 minutes of that was pure inspiration for the things that have inspired me to travel through this journey.
Thank you for sharing that. I wish we didn't make our lives harder with the healthcare system, but it does really show all our gaps when you're going through serious illness, and then you also have a very fragmented healthcare system. So to be able to walk into something like Medicare, which finally feels like it's a full, like the way it should be, when so much of our care is not that way, is hard. But I'm glad that there's also been points of inspiration, whether it's your physicians or this amazing community here where you guys can rely on one another.
Thank you. So one thing that I really being grateful is that, so I started a company actually helping patients like me and elderly like my mom by bringing creative arts to their house, do AI-powered telehealth. And the amount of support that I got when people being sort of touched and inspired by my own story, and then also being present, the contribution that I could have to the community because of I understand what they're going through. And we actually just got funded by NIH. We're currently recruiting patients. And so that was a huge inspiration. Like I moved down to LA during COVID because my mom's getting old. And then I came back. I actually just met with one of my mentors, who's the former president of AARP. And, you know, she was going through a lot of question asking, because I actually had wrong diagnosis before the correct diagnosis came out. That's why the cancer grows so fast, all the way to stage 4 in like less than 2 months, you know, from my first normal brain MRI scan. And in some ways that I would not able to reach this really highly inspired leader in the industry, if not because of my story, in a sense, is also very shocking to them, at the same time also very inspired, and they can understand without me being explaining too much to really understand where I come from. Yeah, so that part is, you know, really like I'm very grateful for it. Like it's a huge breakdown in life, but it's also a huge breakthrough for me personally. And the other thing I would say, I don't know, that's called an inspiration, but it's more like a motivation. I hope that the industry will be more aware. Is like, right now, I appreciate Medicare also, but people with dental challenges after, you know, especially stage 4 head and neck cancer, most of us have dental challenges, and Medicare doesn't really covers a lot of these dental services. So one of my inspirations is like, how could we as a patient group, and also, you know, physicians, the care team, could we bring more awareness to see if this could be, you know, something that the Medicare can cover, because this is one of the biggest challenges for dental care for a lot of patients. Like my feeling just all fall apart in the last month, you know, and now I had to figuring out what to do. I can't no longer, I mean, I cannot get any dental implants because any implant would probably cause potential, what do you call it, like the whole jaw might drop down, all that high risk, right? And so there got to be some other care, and it's super expensive, but Medicare is not really covering that. So I'm trying to learn, you know, what could I do as a patient, being an advocate, to raise more awareness, in partnering with, you know, care groups like you guys, you know, to see what can we create changes for, you know, in terms of policy that would benefit many, many head and neck cancer patients.
I think you bring up a really beautiful point, which is that you all inspire us, right? I mean, we all do this because of what the stories you are willing to share with us. And I think the fact that you're able to touch other people, whether it's leaders in AARP or NIH, it's your stories. It's the fact that you've created learning from the opportunities and from the hardships you've gone through to create a better path forward for other people. And people will listen. You find the right people in the right setting and you step up, stand up, speak out. Like, there are people who want to listen and there are people who are like, how do we make things better? And so I think when it comes to those gaps, like, yes, dental, horrible, right? So again, another huge gap. And for maybe the normal person, it's not such a big deal, but people who've gone through head and neck cancer treatment, it's a huge difficulty. It's a medical problem. And so I think those are incredible learnings. And congratulations on the grant funding. I'm glad that you're doing some amazing work.
Hi, good morning. I was treated at UCLA and I dealt with the head and neck there, Elliot Abelmeyer, a brilliant scientific mind and someone you have to wait a long time to meet with because you're always waiting for him. But at the very beginning of my diagnosis, which again was serious, it was advanced, locally advanced, and I was sort of questioning him a little bit about, whatever I was asking him about, and he just said, listen, part of my job at times is to tell people to get their affairs in order. But I am not telling you that. So go on to your protocol. And so I went through my protocol, and then 2 or 3 months later, I met with him again. And he was very quick and simple with me. He said, quite simply, you have received a gift. And that was it. But I was shaking. But anyway, we've all received a gift, and it's important to recognize that. Thank you.
I really actually don't have many words for that. I think you're absolutely right. And sometimes there are men of few words. Like, it sounds like your doctor was not one to do all the flowers and all the balloons, but he acknowledged the fact that he was giving you a gift. And in return, you were being able to live a long life as a result of the treatment and the protocol, as he said it, to keep going. So. Anyone else?
I just want to do a little plug for the support group that's run every month. Hopefully everyone knows about it because I've definitely been inspired by a lot of people who were here, who were there before me, and I hope that I inspire people who come to the group. So if you don't know about it, it's online, it's every month, and the people there, I mean, just the stories, and we all share things, and I've got friends now that I didn't have from before, and so that just wanted to let you know about the support group. It's very inspirational.
I'm glad. It seems like this is a pretty mighty community, small and mighty, and all of you are able to be open and kind with each other and share some really important learnings and respect each other's voices. So that's huge. So I'm going to just kind of turn to this last one. Any surprises? What surprised you about your journey?
Myself, I've learned a lot of new things. Like I tell people, I said, I only breathe through my neck. But I work construction. My guys were nervous sometimes because I was a yeller at work. And when I was going to have the surgery, they're like, oh, now we're going to have peace and quiet. As soon as I went back after 3 months, they're like, oh, he's back. But I told them, I go, I can't yell as loud as I used to. I said, you'll get the point once I come around. And my surprise was that, people understand, when you get sick with cancer, they're willing to help you in any way. They're more open to learning about it, which is nice. That's why I always tell people to teach others. My surprise when I first got sick was sleeping. That was a big fear of mine because I was afraid to sleep because I was afraid I wouldn't wake up. When I started sleeping with 3 to 4 pillows, then eventually what happened was I would have to tire myself out. And then that's how I fell asleep. I couldn't sleep on my sides, but I would face upwards, and I never slept facing upwards. But to my surprise, it was normal. So I told people, I go, hey, I can do this. After a while, I noticed I could whistle. I would try things. So everybody goes, how do you whistle? I block my airway, and it comes out of my mouth. And they're like, wow. They go, you're learning things. I go, yes. I tried different things because I've always tried to stay positive. That's why I always tell everybody, stay positive. Don't let this sickness get you down. There's no need because you're doing this for yourself. Eating, as some of the folks have said, it does change my flavors changed. I used to love orange juice. I don't like it now because it tastes to me like grapefruit. Meat, I eat any meat I want, steak, whatever I want. I do have to make it smaller, but like I tell people, those are surprising because a lot of people say, but you can't swallow the way you used to because I don't have those muscles in my neck. No, but I do drink a lot of water to push it down. So I am going to enjoy my meals that I used to have, but that I had to stop when I had a feeding tube in me. And then oh my God, I couldn't wait to get that out of me. And that was, like I said, those are my surprises, and like I tell people, I said, stay with each other, stay positive, don't let it get you down. You folks, you all have your own life to live, and you got a long life to live. That's our surprise, that's our gift to the world. We're gonna push ahead. We have to, okay? Because the only person that we're going to let down is ourselves. Okay, that's our surprise for everybody. Keep going, push yourself. You can do it. I did it. I'm still doing it. Thank you.
Thank you so much. That's so beautiful and reflects kind of your amazing optimism as you relate in your keynote as well. That is amazing lens.
So I think the one thing that was surprising, because let me first give kudos to all the medical community folks I interacted with. Almost everything I went through was not a surprise, whether it was food or anything else, because I was well informed of all those things. The one thing that was surprising for me was one of the side effects. I think most people have heard of the term chemo brain or something of that ilk, which in my case translated to some significant loss in the hippocampus, so impacting short-term memory. And I don't think there's been nearly enough study on that in terms of before going through treatment, whether it's chemo, whether it's immuno, whether it's radiation, and discovering what the impact of these different treatments can be on different parts of your body. So that was a huge surprise for me, and it's still something I try and interact with different parts of your community with in terms of seeing if we can get funding for stuff like that so that we can have a better understanding of is this impacting people? Is there is there any information around who is being impacted and why, in terms of the different treatments for cancer? But it would be great to remember that we're always learning, even as we continue to improve, such that we keep not just bettering all the things that we've talked about, whether it's a food experience or anything else, but all the things we don't know about yet that are just coming to light because we're solving for all the ones that are the biggies. Thanks.
Yeah, and I think that your voices really raise these issues up, right? Because these are the things that we don't study as well. And we don't always, as you said, people talked about the things they knew about, dry mouth, like radiation effects, but like the cognitive changes are things that we're still figuring out. We don't talk about it as much. We don't always know how to talk about it, what to expect from it. And so it's a bit harder to talk about. It's harder to know what to expect, and it's harder to mitigate. And so I think having your voices step up and say, this is important. We need to talk about it. We need to think about, are there ways that we can prevent it? People are living longer. We want people to live well longer. So what can we do to make the experience easier and have less toxicity down the line so that people can maintain the best quality of life for the longest period of time. I only have a few minutes, but you guys actually did the entire lecture for me, so thank you. I think, what you guys have proven is that this is doable, right? Like in the beginning, and many of you I can hear have been the voices that are stepping up, and I'm sure there are some quieter voices in the room, are showing us it's doable. And there might be other voices that are quieter, that are trying to figure out, is this doable? I don't know, right? And it's about you guys linking arms and saying, yeah, it is. And we're going to show you the way, and we're going to make it doable for you. And so I think that this is a pretty amazing community that you're establishing. I'm sure no one woke up one morning and said, I wish I could be part of this community. But you're here now, and you're choosing to show up. And you're choosing to say, I'm here to help. I'm here to learn with you, and I'm here to show you a way to make it doable. So there's like 10 more slides in my deck with lots of really interesting information. I think Heather will share them all with you. But please take a look, has some great supportive care resources, talks a little bit about symptoms and survivorship. But I feel like this was the most valuable use of time, and I'm very grateful to all of you. I hope I get to meet all of you as individuals and continue to learn with and together. And thank you.